all healthcare workers in the public and private sectors will be prioritized for vaccination. Provincial health departments have submitted their distribution plans, and we have identified about 200 facilities throughout the country to which the vaccines can be distributed. Once we have completed the vaccination of health workers, we will move to phase 2 of the National Vaccine Strategy, which will include essential workers, people over 60 years, people with comorbidities, in other words, other health challenges, as well as those living in places such as nursing homes and hostels. In phase 3, we will extend the vaccination program to the rest of the adult population. I know that many of you will be asking yourselves all the important questions. How will you access the vaccine if you fall in the categories to which I have referred? The Department of Health has developed an electronic vaccine data system to streamline the vaccine registration and rollout process. This will allow us to capture all relevant data which is associated with the administration of the vaccine. This system allows a person to make an appointment as soon as they qualify for a vaccination at the vaccine center closest to where they are. The system will record vaccinations as they are administered. As I said during my previous address, we are sourcing our vaccines from a number of suppliers. In addition to the 1 million Covishield doses that we've just received today, we expect another 500,000 doses from the Serum Institute of India to arrive later in February. We have secured 12 million doses in total from the Global COVAX facility, which operates under the WHO, which has indicated that it will release approximately 2 million doses by March. We have secured 9 million vaccine doses from Johnson & Johnson, commencing with delivery in the second quarter. Johnson & Johnson has contracted Aspen, one of our pharmaceutical companies here in South Africa, to manufacture their vaccines at their manufacturing plant in Nelson Mandela Bay. In addition, Pfizer has committed 20 million vaccine doses, commencing with deliveries in the second quarter. We are in advanced negotiations with manufacturers to secure additional supplies. South Africa will also receive an allocation of vaccine doses through the African Union, which has been negotiating with manufacturers to secure vaccines for the entire continent on a pooled basis. Through the African Vaccine Acquisition Task Team of the African Union, which is led by Mr. Strive Masiyiwa from Zimbabwe, on which our Health Minister, Dr. Zwelini Mkhize, also sits, we have to date secured 1 billion vaccines for the entire continent. 700 million of these will come through the Global COVAX facility, and 300 million have been facilitated by the African Vaccine Acquisition Task Team. We will be getting other vaccines that will be donated by various private sector companies to add to the vaccines that our continent needs. MTN, which is one of our companies that operates across a number of countries on the African continent, has made a donation of $25 million to procure 7 million vaccines, which will be made available to countries on the African continent within a matter of weeks. And it is from these that our immediate neighbors, who we are also concerned about, like Lesotho, Eswatini, Botswana, Zimbabwe, Mozambique, and Namibia, who are immediately around us, and to those countries many of our people travel to, and their people also come here. They will also benefit fairly soon from this facility or from this donation.